Hi, my name is Christopher May. It is June 24th, 2021. I'd like to talk about surface anatomy with my roommate, Sophia. So basically with surface anatomy, it's basically analysis of what's going on the superficial level of the body, and it gives us an idea of what's happening inside the body as well. So with surface anatomy, if you're proficient at it, you can see what further tests need to be taken, or also what procedures need to be done and where those procedures and tests need to take place. So looking at Sophia, we're going to start with the medial cuboidal vein right here. So the medial cuboidal vein is very prominent in the skin. It gives us access to the blood, which is part of the cardiovascular system. And having this access means that you can draw blood easily and test it and even use it for donation purposes as well. And then you can also put an IV drip in as well, which allows you to hydrate dehydrated patients, or allows you to give pharmaceuticals to patients so that bypasses the liver because it's going directly into your bloodstream. Next, we have the spinal processes. Put a little big piece of tape right here, just to show where L3 and L4 and roughly where L4 and L5 are. Basically, this area is where a spinal tap is performed. So because the spinal processes, even though it is the skeletal system, it provides landmarks for where procedures should be done and where certain organ systems should be. So with the spinal tap, it gives you access to the cerebral spinal fluid, which when you take that cerebral spinal fluid, you're able to analyze it and see what's happening within the nervous system of the spine and the brain as well. Next, we will be moving to the right costal margin right here. So basically, even though it is part of the skeletal system as well, with the ribs, if you palpate below that, that's where the liver is, where it's part of the digestive system. So being able to palpate that and see if it's swollen, it could let you know if there's any digestive problems going on in the body. So then, next one, we have our cervical lymph nodes right here. So with the cervical lymph nodes, if they're swollen, if they're tender, if they're painful, a lot of time it will let you know if there's an infection going on, and in some cases it will let you know if there's cancer in the body as well. And then, last but not least, there is the trachea and the thyroid cartilage. So where the Adam's apple normally is, right below that, that's where you perform a tracheostomy. So basically, what happens there is if there is part of the upper respiratory system that is blocked, it allows you easy access to the respiratory system and allows you to help patients breathe. And it's also involved in the endocrine system because deep to that thyroid cartilage is the thyroid, and you don't want to damage that. So thank you. Hope you appreciated that.